to my YouTube channel. Today we are going to talk about the preoperative assessment. So the preoperative period, it's or the assessment, it is an opportunity that helps you to detect or to identify comorbidities that lead to complication of your patient. It's either it could be anesthetic, surgical, or during post-op period. So the three components of preoperative assessments are the history, examination, and investigation. So the history, if you're already a clinician, you know that history and clinical examination are fundamental for clinical aspects, and you're just going to take your normal history and emphasizing on specific parts. So for example, if it is history of presenting illness, so why is the patient here? So why did the patient attend this clinic, and what is the scheduled procedure? You may also identify aspects of the disease or the condition requiring surgery that may be important to the anesthetic. So for example, if the patient has an abnormal airway anatomy, etc, etc. So the next is past medical history. Past medical history, here there are conditions that increase the morbidity of the patient post-op, the morbidity of the patient, and also the mortality of the patient post-op. Conditions include cardiovascular diseases, renal diseases, respiratory diseases, among others. So in cardiovascular, does the patient has hypertension, or is the patient suffering from other diseases? Respiratory, you assess if the patient has adequate oxygenation and ventilation. This question you know how to access. Does the patient has obstructive sleep apnea, among others? Renal function or renal disease, here you include, obviously you have to include, does the patient take any specific renal medication? Obviously this you also include in the drug history, or how is their base renal function, among other renal system questions. Endocrine, this is especially for diabetes mellitus and thyroid disease. And gut, so does your patient already has existing or past medical history? Next is past medical surgery. Ask if the patient has had any of a previous operation, and if so, what operation and when and why. So those are the questions that you are going to ask. If does your patient has had past anesthetic history, and if so, what type of anesthesia was used? Were there any problem with the specific anesthesia used? Did they experience any post-op nausea and vomiting? Drug history, here you have to take a full drug history of the patient, because in surgery there are drugs that we need to stop, there are drugs we need to alter, and there are drugs we need to start. So here you also asked about allergies, both drug and non-drug allergies, that is non-food and drug allergies. So the next aspect is family history. Do we have hereditary conditions? These conditions may be relating to anesthesia, which are maybe extremely rare, for example malignant hyperthermia. The next is social history. Does your patient smoke? Does your patient take alcohol and use recreative drug use? So the next aspect of our clinical aspect is examination. Here you do a focusful examination and obvious systemic examination, in addition to anesthetic examination. So the preoperative investigations that we are going to do are blood tests, that is full blood count. Here we get a full blood count of the patient. You assess if the patient is anemic or thrombocytopenia, and if any of this is present, it may require correction to reduce the risk of cardiovascular events and allow for proper blood for you all to prepare the blood products in advance. So the next is urea and electrolytes, that is UECs. This is to assess the basal renal function. This is to help you and inform you to help inform fluid management and drug decision, both for anesthesia and post-operative anesthesia. For example, morphine is generally avoided in patients with CKD, that is chronic kidney disease. Liver function test. This one you assess the liver metabolism and synthetic function. It is useful preoperative if there is suspicion of liver impairment, and It helps in medication and choice of the drugs and dosing. The condition-specific blood test, for example, if your patient has thyroid disease, you have to take that. If your patient is diabetic, you also have to take HB1C. So the next is clotting screen. Any condition or any indication of deranged coagulation, so for such as iatrogenic warfarin, inherited coagulopathy staging for hemophilia A or B, or liver impairment, will need correction before the surgery. Also, you have to take you have to group and cross match your blood in case of an emergency where you need it.